Hi, I'm David Merritt with the Center for Health Transformation. Today I'd like to talk with you a little bit about transforming healthcare in America through information technology. Now, when you look at healthcare, you can take your pick from a whole host of problems that we need to sort through, both on the cost side and on the quality side. Budgets are exploding. In fact, Jeb Bush, former governor of Florida, told us that if nothing changes in the next 10 years, Medicaid, which currently consumes about 28% of the general revenue, is going to explode and consume about 58% of all revenues. And that's going to crowd out transportation, crowd out education, parks and recreation. Any priority you can name, Medicaid will crowd out. On the other side, the quality indicators are still lagging and are going down. The Institute of Medicine actually estimates that up to 98,000 Americans are killed every year by medical errors, preventable medical errors. And the quality of care that Americans receive has not improved over time. Another study says that only 55% of the time do Americans receive documented clinical care that's evidence-based. So we have a lot of daunting problems. But what I'd like to do, before saying this is a hopeless situation, is to take us back to the turn of the 20th century, because our predecessors faced a similar problem. They had a whole host of issues that they were working through, but over time they transformed medicine in America. What I'd like to do is just read you a quick clip from a book called The Great Influenza. Remarkable book, and it sets the stage for how medicine in America was up until the late 1800s. It says, most medical schools in America were owned by a faculty whose profits and salaries, even when they did not own the school, were paid by student fees. So the schools often had no admission standards other than the ability to pay tuition. No medical school in America allowed medical students to routinely perform autopsies or even see patients, and medical education often consisted of nothing more than 4 two-month term lectures, and few medical schools had any association with a university, and fewer still had ties to a hospital. In the late 1800s, even at Harvard, a medical student could fail 4 of 9 courses and still be a doctor. Charles Eliot was named president of Harvard in 1869. In his first report as president, he declared, "The entire system of medical education in this country needs thorough reformation. The ignorance and general incompetency of the average graduate of the American medical school at the time when he receives his degree, which turns him loose upon the community, is something horrible to contemplate." Soon after this declaration, a newly minted Harvard physician killed 3 successive patients because he did not know the lethal dose of morphine. Even with this leverage, Eliot could push through only modest reforms over a resistant faculty. The most powerful faculty member, Professor of Surgery Henry Bigelow, protested to the Harvard Board of Overseers saying, "The president actually proposes to have written examinations for the degree of Doctor of Medicine." I had to tell him that he knew nothing about the quality of the Harvard medical student. More than half of them can barely write. Of course they can't pass written examinations. And no medical school has thought it proper to risk large existing classes and large receipts by introducing more rigorous standards. So when you think that that was not that long ago, in fact they were practicing medicine literally from the Greek and the Roman times. They were still bleeding people. But over time, this generation of leaders really transformed medicine in America. And I think that we have the opportunity to do the same thing. Now our problems are certainly different, and change won't be easy, but I think that we can work through these issues. Now, just to put the size of the problem in perspective, and to really show you or tell you the size and scale of the challenges we face, today we spend more than $2 trillion a year on health care. Now, our economy is massive, but that is the largest single sector of the economy at about 16 or 17%. To put that in perspective, we spend as much on health care as the entire economy of China, the entire economy of Britain, the entire economy of France. And actually, our healthcare budget doubles the entire GDP of the nation of Canada. So we have a huge industry that we need to work through. But Newt Gingrich, the founder of the Center for Health Transformation, really has been working on this issue for a long, long time, and he founded the center to help provide some of these solutions that we think can help transform healthcare from where we are today to where we need to go, to a system that has more choices of greater quality at lower cost. Now, one of the things that we think you really have to lay a foundation with is health information technology. When you walk into a Walmart, the technology that sits behind every product on the shelf is stunning in its sophistication, its efficiency, and its effectiveness. But when you walk into healthcare and walk into a typical physician's office, it's like taking a step backwards in time. All you see are rows and rows of paper medical records. And with paper medical records, they're efficient and often deadly. So what we need to do is actually move healthcare from the world that fails to the world that works, to use Newt's line. You know, the joke is that when you walk into the typical physician's office, your BlackBerry or cell phone doubles its computing power. And in many cases, that is correct. The adoption rates of technologies like electronic prescribing and electronic health records is very, very low. But these technologies are quite effective in improving care. Electronic prescribing, for instance, is an easy technology that allows a physician to electronically send a prescription to the pharmacy, which eliminates the dangers of sloppy handwriting, being misread by a nurse or a pharmacist. Medication errors alone kill more than 7,000 Americans every year. So electronic prescribing, where you cut out all of the manual processes from doctors and providers and move to something that's automated, will save lives. Another technology that's becoming more commonplace are electronic health records. This is the electronic capture of data that replaces the stacks and stacks of manila folders that we've all known over the years. This information, when it's available electronically, can save your life in an emergency. Physicians can automatically pull up your medication history, your current medications, any allergies you may have. And having that information in an emergency can certainly save your life, whereas a paper medical record sitting on a shelf collecting dust certainly can't help in that situation. And you can ask folks around the country. There are pioneers out there who are really moving forward with health information technology. The folks at Piedmont Hospital in Atlanta, for instance, introduced something called computerized physician order entry, which physicians use for electronic prescribing, as well as what's called decision support, where an automated service actually helps guide them through the process of prescribing and treating a patient. Piedmont actually documented a 90% drop in medication errors when they went from a paper system to an electronic system. 90% drop. Going back to the statistic I mentioned of 7,000 deaths every year from medication errors, if we could cut that by 90%, think of how many lives we'd save. Intermountain Healthcare in Salt Lake City, Utah, is another pioneer when it comes to health information technology. Brent James is a real leader in the industry, and what they've built over the last 20 years is really remarkable. About 80% of the care that they deliver has been, the data has been collected and analyzed and then implemented and integrated into their clinical care. So everything that they do at Intermountain is based on evidence, and it's based on data of what works and what doesn't work. And it's all captured electronically. It's really a remarkable success story. And they're working with GE Healthcare to really create a next generation electronic health record that I think will be a model for others to emulate. Now, Newt Gingrich has a simple phrase that I think really captures the essence of technology, and that is that paper kills. In fact, we have a new book with that same title that we just released earlier this year. And we really think that paper is such a danger that it needs to be replaced completely. And over time, we think that health insurers, doctors, hospitals, and consumers can actually make this transition from paper to electronic. Now, as I mentioned before, the problem that we see is that many physicians and hospitals don't actually have this technology in place as we speak. But that is changing. About 10 to 15% of all doctors actually use electronic health records. Hospitals are a little better. About a third of all hospitals have electronic health records and other technologies in the course of clinical care. And the problem, though, when it comes to adoption is not that it's, the technology isn't there. In fact, physicians agree that the technology can save lives and save money. There was a survey recently about electronic prescribing, and the survey was with about 500 physicians, asking them about the pros and cons of electronic prescribing. 85% of physicians said that e-prescribing is a good idea. 81% of physicians said it would reduce medication errors, and 75% said that it would actually save time. But when asked, do you actually electronically prescribe, only 7% said they did. 63% said that they don't even have any plans to move to electronic prescribing and do not make it a priority at all. So you have to wonder, if it's so good when it comes to delivering better care and saving money, why is it that physicians aren't moving toward it? Well, there are a few reasons. The first is that regulation often stands in the way. There are a whole host of state and federal laws that are on the books that really block physicians and provide a disincentive to physicians to move to health information technology. A good example is there's an issue in Medicaid where a home health worker can actually go out and visit a Medicaid beneficiary, and there is a technology where once that home health worker arrives at a home, they can use the phone to electronically punch in. They dial a number, and it captures exactly when they arrived at the house, and they begin their work. So they visit with the beneficiary, they take care of whatever they need to take care of, and when they leave, they dial the same phone number, and it electronically punches them out. 37 state Medicaid programs require those home health workers to actually print out their electronic punch cards and mail in hard copies to the Medicaid program, even though the technology has already electronically captured and it could be sent via a secure email. So state laws often stand in the way and really retard progress toward a modernized system. There's another law in the books that's called the Stark and Anti-Kickback laws. And these are designed to root out corruption between doctors and hospitals. Basically, we don't want hospitals having a financial relationship with any doctor that may influence their prescribing patterns or their referral patterns. So there is certainly a need for that kind of law. But what the law also does at the same time is that it blocks hospitals and physicians from working together on health information technology. As I mentioned before, hospital systems are much more likely to have electronic health records than community physicians. And oftentimes those hospitals will want to give that or donate or perhaps give at cost that technology to the physician and actually have connectivity between the community physician and the hospital. Well, Stark and Anti-Kickback actually stand in the way of doing that. Now, those laws have been relaxed a little bit, but at the same time they still remain quite a barrier to physician and hospital collaboration. Now, secondly, consumers just haven't demanded this technology. You know, we've come to expect when we walk into a physician's office or a hospital that we're going to see those paper medical records. It's something we've been conditioned to expect. But the next time you go in to visit your doctor and they hand you a clipboard, I think you should ask them, can I fill this out online next time? The next time you see your doctor writing a prescription on a piece of paper, ask him or her if they can submit it electronically to the pharmacy. The next time you need to pick a new doctor, ask your insurance company if there's an online resource where you can go and find out cost and quality data about that physician. Now, you'll get a lot of raised eyebrows, certainly, because all of those things hardly happen in healthcare today, but we are moving in that direction. And we as consumers can push that ball forward if we can be the ones who continually ask those questions and ask those stakeholders, like doctors and hospitals, for them to move forward and provide us with more convenience. Now, lastly, the reason why physicians and hospitals haven't moved to information technology like the rest of society has is that it's not in their financial interest to do so. Currently, the way that doctors and hospitals are paid or reimbursed is simply by how many transactions they complete. So it doesn't really matter if they deliver good quality or poor quality. They're going to get paid exactly the same. So what we need to do, I think, is move from a transaction-based reimbursement model to one that actually is based on outcomes, because that will incentivize providers to adopt the tools that they need to deliver better quality. Take, for instance, Richard Barron. He's an internist outside Philadelphia, and he has an electronic health record by GE. They invested about $150,000 in their 4-doctor practice for this technology, and they documented that they are delivering better care at lower costs. The problem, though, is that Independence Blue Cross, Medicare, Medicaid, not a single insurer is actually paying them more or rewarding them for delivering better care. Whereas the doctor across the street may be practicing medicine from the 1970s with a paper medical record. He's still getting paid the same. We would never expect that in our everyday lives. We wouldn't pay the same price for a Yugo as we would for a Cadillac. But in healthcare, that's in essence what we do. So the payment model really needs to shift from one that's based on volume and transactions to one that's based on the actual health outcomes of the provider. So getting back to what I mentioned before about the great influenza and medicine at the turn of the century, I want to read you a quote from one of the leaders of that era, Dr. William Osler. He said, "Having lived through a revolution, to have seen a new birth of science, a new dispensation of health, reorganized medical schools, remodeled hospitals, a new outlook for humanity, is not an opportunity given to every generation." He was one of the giants that actually transformed healthcare in America. And I think our generation has been given that same opportunity. And with your help as a consumer, you can help push through these reforms just as effectively, if not more effectively, than what's happening in Washington and state capitals across the country. If you'd like to learn more about transformation and health information technology, please visit our website at the Center for Health Transformation at www.healthtransformation.net. Thank you.